Welcome everyone to this Zoom conference hosted by MS Focus, the Multiple Sclerosis Foundation. I am your host, Kimani Hendricks, and I'm the Multimedia Communications Coordinator for MS Focus, and I'm joined today by Angeli Mayadev. She will be speaking to us about relaxation techniques, deep breathing, and guided meditation. After the presentation is over, as I said, we'll allow time for questions, and we want to welcome as much interactions with all of you as we can. So without any further ado, let me introduce our speaker. Dr. Mayadev is a physical medicine and rehabilitation physician who specializes in the treatment of patients with multiple sclerosis. Her clinical interests include improving the mobility of patients, musculoskeletal rehabilitation, orthotic prescription, and spasticity management. For the past 12 years, Dr. Mayadev continues to find joy in caring for patients over time and being a part of their rehabilitation care team. And we're pleased to have her join us to present this important topic. Dr. Mayadev, thank you for being with us today, and I am going to turn it over to you.
Okay, thank you so much, Connie. I appreciate everyone being here today. And this topic has come up a lot recently, which is, what we can do as a community to reduce anxiety and help just promote wellness and a sense of being connected. So we have set up at our MS Center a weekly Friday session where basically we do relaxation techniques, deep breathing, and guided meditation. So that's what we're going to do today for about 40 minutes, and then we'll leave time for questions and answer. So I break this up into spending some time kind of getting into the present moment, and then we spend some time doing deep breathing techniques, and then a guided meditation. And then we actually spend about 10 minutes doing silent meditation. And what I'm hoping is that you'll pick up a few things from this today to practice at home and to continue sort of with your daily routine. And like everything, practice is something that helps gain expertise and knowledge. So the more you do some of these things, obviously, the better. So we'll usually start out with just taking a few moments for everyone to sort of find their breath. And if you would like to close your eyes during this entire session, you can, and I can tell you when we're doing some of the demonstrations. So go ahead and just sort of come here, put all of your attention here with all of us right now. There's nowhere else that you have to be. You've given yourself this hour just to be and to practice. And just start to sort of feel your breath. Feel your in breath and your out breath, and what that feels like to you. You can sit up nice and tall in your chair, and we'll spend a few moments just being here, where we focus on our in-breath and our out-breath. And we feel if there's any tension anywhere in our bodies. Sometimes we hold tension up in our shoulder areas. Sometimes we hold tension in our pelvis or in our low back. And we'll just be aware of some of those feelings. And we're going to start to focus once again on our in-breath and our out-breath. Our in-breath and our out-breath. And when we focus on our in-breath and our out-breath, we're really calming our minds. And as we all know in medicine, there is a mind and body connection. And what really links the two is our breathing and a lot of our hormones. We call it the catecholamine fight or flight response. And a lot of the times we're kind of in a heightened mode of awareness. We're in this flight response. And what we're trying to do is actually get into a calmer state of being in which we focus on our breath as a means to calm our minds and to also convert into a parasympathetic system from a sympathetic system. The sympathetic nervous system helps us control our flight response, or if we have to respond to something immediately. But our parasympathetic system allows us to relax and control our responses more. So we use the breath as a means to actually use our body to help calm our minds and our body. And we also know that in MS, we're trying to strengthen our diaphragm. Our diaphragm is controlled by our cervical spinal cord. And the more that we can control and strengthen our diaphragm, we can help our breathing. We also will spend some time focusing on some of our accessory muscles of breathing, a lot of our neck muscles and our intercostal muscles, because the more we can strengthen these muscles as well, it helps our breathing. So that's kind of the whole purpose of this, is to help calm our minds, which then helps calm our bodies. So let's start out doing a demonstration of a few just quick yoga poses. What we typically do is start from the top and head down. So go ahead and just turn your head, if you're able, to the right for about 3 to 4 seconds. And then you can come back to midline. And then to the left for 3 or 4 seconds. And then you can come back to midline. And then ear to shoulder. And midline. Ear to opposite shoulder. Good. Back to midline. And then we'll roll our shoulders backwards 3 times. 1, 2, 3. And then we'll roll them forward 3 times. 1, 2, 3. Good. And then we'll twist to the right in our chair. And we'll come back to midline. And then we'll twist to the left in our chair. And we'll come back to midline. Good. And then we'll just, if we're able to, we can move our hips back and forth a little bit. Good. And then we'll move our knees back and forth. And all this time, we're just still trying to calm our minds. We're using our body to try to calm our minds. And then we'll move our ankles up and down. And then we'll roll our ankles out to the side and then back. And then out to the opposite side. And then back. Good. And now that we've done some of our yoga poses, we will start our first deep breathing exercise. So these deep breathing exercises help expand the amount of time per breath. And so what we're going to do is I'm going to demonstrate. The first one we're doing is what we call a diaphragmatic breath. Now, the physical therapists teach this, and it's actually quite simple. all you're doing is you're taking a deep breath from your belly and you're letting it out. And so when you take a deep breath in from your belly actually expands outward. So you kind of want to take a deep breath. When you're taking a deep breath in, your belly will kind of go out. And then as you exhale, the belly will come in, belly button to the spine. And so when we take a deep diaphragmatic breath, our chest doesn't move very much. It's really our abdomen, our belly that's moving. And, when we're young, we breathe like this. And then from years of sitting, we end up breathing a lot from our chest. And so what we're going to do is I'm going to count it out. And so I'll say, take a deep breath in through your nose, and I'll count to 3. Then you'll hold it for a count of 3, and then we'll exhale for a count of 5. And so you want your exhale typically to be longer than your inhale and your hold. And what we're doing is trying to really focus on our breath and expanding the amount of time that we breathe so that we go from short, small breaths to long, deep breaths. With this, just as a warning, a lot of times we're used to taking short, shallow breaths. So if you start to feel dizzy or lightheaded, just go ahead and go back to your normal breathing pattern. What happens physiologically is that when we take longer, deeper breaths, we're actually exhaling more carbon dioxide than we're used to. And that's why in the cartoons, when people get nervous, they give them a paper bag so they can breathe back in their carbon dioxide. So if this happens, just go back to your normal breathing pattern and your lightheadedness will go away. So we'll do this for about 10 rounds of this. And so I'll just do the first demonstration. So you would take a deep breath in through your nose, hold it, and then exhale through your nose. And then it's okay to take your normal breath in between as well. And then we'll do the next round. So go ahead and get comfortable and sit up tall if you can. We want your spine kind of tall. That helps promote your chest and lung capacity. And what you can do now is go ahead and put one hand, actually, if you're able to, on your abdomen, and put one hand actually on your chest, and take just a few normal breaths and just see which hand moves more. So just some normal breaths that you normally would. And you kind of get a sense for your normal breathing pattern. Ideally, the top hand doesn't move that much and your bottom hand moves a lot. That may or may not be the case right now, but that's what we're focusing on and trying to move towards. So we'll go ahead and start, and I will count it out. So you take a deep breath in through your nose. 2, 3, hold. 2, 3, exhale. 2, 3, 4, 5. And we'll breathe one round normally. And then we'll take a deep breath in. 2, 3, hold. 2, 3, exhale. 2, 3, 4, 5. Deep breath in. 2, 3, hold. 2, 3, exhale. 2, 3, 4, 5. And when you inhale, you really want to feel your belly expand And when you exhale, you want to feel it go in, kind of belly button to the spine. So again, inhaling through your nose, hold, exhale through your nose. And really listen to that inhale and exhale. Inhale, hold, exhale. Inhale, hold, exhale. Deep breath in, hold, exhale. Deep breath in, hold, exhale. We'll do a couple more rounds. Deep breath in through your nose, hold, exhale. Deep breath in, hold, exhale. We'll do one more round of this. Deep breath in, hold, exhale. Good, and then we'll take just a few moments to check in with our normal breath again. And that diaphragmatic breathing that you just learned, you can change the ratios. So we did a 3 in breath, hold for 3, exhale for 5. The more you practice, the longer it will become. So you could end up taking an inhale for 4 seconds, or a count of 4, hold for 4, and then exhale for 6. So what you always want is your exhale to be slightly longer than your inhale and your hold. And that helps promote strengthening of your diaphragm. Now, the next deep breathing exercise that we'll go over is a breathing technique called Ujjayi breathing. This is a breathing technique that is also very helpful for calming the mind and body. In this breathing technique, you would once again take a deep breath in through your nose, and you would hold it, and then you would exhale through your mouth like you're fogging a glass. So you really, the accentuation is on the exhale, like and this is taught in a lot of yoga studios. It's called Ujjayi breathing. And it really does help promote calming the nervous system. So I will demonstrate this breathing technique. So once again, I would take a deep breath in through my nose. I would hold it. And then I would exhale through my mouth like I'm fogging a glass. And sometimes you can think of this breathing technique as breathing in, calm, and then breathing out, letting go of all of your concerns. So we will do a few rounds of this breathing technique. And once again, when you do your breathing techniques, you want to kind of sit up nice and tall and focus on your breathing when you do this. Sometimes you can listen to your in-breath and your out-breath. That helps calm the mind. So we'll take a deep breath in through our nose. Hold it. And then exhale through our mouth. And when you exhale, you're really, once again, feeling that belly button to the spine and just really letting go of all your breath. We all have a certain amount of breath that we keep in our lungs. We call it the tidal volume. And there'll always be a little bit of volume in our lungs. But what we're trying to do is really go down to that amount, the residual tidal volume. So we'll do a few rounds of this, about 6 rounds. So we'll take a deep breath in through our nose. Hold. Exhale through our mouth. Once again, our ratio is like a 3-3-5. 3 in, 3 hold, and then 5 out. So deep breath in through our nose. 2, 3, hold. 2, 3, exhale through our mouth. Good. One more time, inhale in. Hold. Exhale. Like HA sound, like you're fogging a glass. Inhale in through your nose. Hold. Exhale through your mouth. Inhale. Hold. Exhale through your mouth. We'll do about 3 more rounds. Take a deep breath in. Hold. Exhale. Deep breath in. Hold. Exhale. One more time. Deep breath in. Hold. Exhale. Good. Okay, now we'll take a few moments just to kind of catch our breath. And just breathe. We'll just breathe normally, just because we've been doing a lot of deep breathing, and we might not be used to that. So we'll go back to our normal breathing pattern, and we'll be aware, if we're breathing mostly from our diaphragm or from our chest, and we want to try to lengthen our breathing, really feeling through that diaphragm, prolonging our breathing. Now, another breathing technique is one that actually helps with posture and also helps strengthen some of the accessory muscles of breathing. Our intercostal muscles that lie in between our rib cage. Some of our neck muscles are accessory muscles of breathing, like our sternocleidomastoid. This breathing technique is a little bit more physical. So if you're able to do this, that'd be great. If you can't, then you can just breathe in and out. But what we will do is on the in-breath, I will demonstrate. You take a deep breath in and you hold your arms like this. And then on the exhale, you breathe out through your nose and you put your arms down. So that way we're actually kind of promoting some of the strengthening of our accessory muscles. And we'll do this about 5 rounds. We'll keep the ratio the same, the in-breath of 3, the hold of 3, and the exhale of 5. And we'll just do about 3 to 5 rounds of this more for demonstration. So we'll take a deep breath in, hold, exhale through our nose. Deep breath in, hold, exhale through our nose. Deep breath in, hold, and we're kind of pulling our shoulder blades back and down when we do this. We don't want to be riding up and then down. Deep breath in, hold, exhale through our nose. Okay, last round of this. Deep breath in, hold, exhale through our nose. Great. Okay, everyone. So those are the 3 deep breathing techniques that we use. The diaphragmatic breathing, where we really focus on elongating our breath, really breathing through our diaphragm, through our abdomen. Our ujjayi breathing, where we really sort of take in a deep breath and then kind of let go of all of our worries and concerns through our mouth, like we're fogging a mirror. And then the strengthening one, which is where we pull our arms out and up when we take our deep breath, and we pull our arms down when we exhale. So those are 3 breathing techniques that you could practice at home. Even like 5 minutes once a day actually would do quite a bit of good. It's more the regularity of things. And now we will start our meditation portion. Now that we have done our deep breathing exercises, we will find that it is easier to control the mind now that we have calmed our body and calmed our mind with our breath. We will do a guided meditation, and then we will do some silent meditation, just to get into that habit and practice. We will do the silent meditation for about 8 minutes, and I will mind the time. So everyone, once again, go ahead and get comfortable. And for this portion, I encourage you to close your eyes if you're willing, just because that does help promote relaxation. If you prefer to keep your eyes open, that is fine as well. But we will spend a few moments just getting back in touch with our breath. We use the breath as an anchor. And we will listen to our in-breath and our out-breath. And we will focus on our in-breath and our out-breath. And we will just breathe as we normally would. And for our guided meditation today, we are going to do a common guided meditation, which I find very helpful. It is a meditation on going from the very small to the very large and to the very small. And so when we are focusing on our in-breath and our out-breath, we will contemplate upon the smallest thing we can think of. Some would think that a grain of sand would be the smallest thing that we can think of. But even smaller is an atom. And even smaller than that are electrons. And the smallest particle is something called a quark. And these small molecules have spaces between them and around them. And we will focus on that space in between these small molecules. And this space is all around us and inside us. And as we think about our in-breath and our out-breath, we will focus on the space between our in-breath and our out-breath. And now we will consider our earth and how large our earth seems. The 7 continents and the vast oceans. And we are all together on this earth, and how vast that seems. And then we will go out of our earth and think about space. And we will be seeing Earth from space. And we will look around and we will see dark space around us. And we see the earth floating there, spinning on its axis. And we go out further and we see the sun. And we go out still further and we see the Milky Way galaxy and all the space around it. And we go out further, even past our own galaxy, and we see other galaxies and other suns and other stars. And we think about the vastness of that, the vastness of space, the vastness of our being. They say that we're all actually made of stardust, and how we're a part of that. And how we started off thinking of something so small like a grain of sand. And we've come out to outer space, to something so large and expansive. And now we are back to small as a part of this amazing whole. And we will focus on the space between our in-breath and our out-breath. And as we start our silent meditation, we will continue to focus on our in-breath and our out-breath. And we can focus on the space between our in-breath and our out-breath. And if thoughts come, we can just let them come. We don't have to follow them. We can just be a witness to them and return to listening and feeling for our in-breath that goes into our out-breath. Breathing in, I feel a sense of space. Breathing out, I feel free. Breathing in, space. Breathing out, free. You could say that to yourself as a means of concentration as well, or you could just listen to your in-breath and your out-breath. And I will mind the time. You'll do this for about 8 minutes. And just focus on your in-breath, going to your out-breath. If thoughts come, you can just return to your in-breath and your out-breath. And now we will start to focus on our in-breath and our out-breath and start to slowly come out of our silent meditation. And we will really try to feel our in-breath and our out-breath. And focus on how we feel. gradually we feel calm or calmer than maybe when we started. And sometimes the effects are not immediate, but you might see how you feel the rest of the day or even tomorrow. And we can always return to our in-breath and our out-breath anytime as a means to focus and calm our minds and our bodies. And we have some time for question and answer. If anyone has any questions about the breathing techniques or meditation practice in the setting of MS, let's see if I don't know if there's anything in the chat box. No.
For our participants, if you do have any questions, you can either type them into the chat box. That way, either myself or Dr. Mayadev can read them aloud and she can answer your question from there. Or you can use the raise hand feature. It's under the more option on your screen. And then when we see a hand raised next to your name, we can unmute your microphone so you can speak directly with Dr. Mayadev as well. But we'll wait for those to come in. But I actually do have a question, Doctor.
Okay.
Since meditation is a stress reliever for just about everyone, and most flare-ups from MS are caused by stress, is it safe to say that practicing regularly slows the progression of the disease?
Well, so there is that. I would say that is a possibility. I think there's really good evidence in the medical literature that meditation and mindfulness, most of the literature has been on the Jon Kabat-Zinn mindfulness technique in healthcare. And also the transcendental meditation technique has also been studied. And the Chopra Center also does research, the Deepak Chopra Foundation, the Chopra Center based in Carlsbad, California. They do research, and their research has shown that meditation and mindfulness practices, it decrease blood pressure, they decrease cardiac issues, they actually decrease cholesterol and lipid values. Mm-hmm. Apparently, it also helps reduce risk of diabetes and increases fertility. And MS has not been yet extensively studied. But we can surmise that because it does reduce stress and it reduces your overall catecholamine response, mm-hmm. over the long term, we would say that hopefully it does help MS. I think we need to do those studies, but we know that it's the chronic stress of MS that contributes more than acute stress. In MS, actually, they did studies during some of the Gulf Wars, and what they found was acute stress actually causes people to release stress hormones, similar to what we give people when they have an MS exacerbation.
Yeah.
So they actually release stress hormones. So it's really the long-term stress, the chronic stress, that sometimes affects MS. And so I would say that these techniques definitely can help that.
Now, I've heard of mindfulness-based cognitive therapy. What's the difference between that and the deep breathing that we just practiced?
Yeah. So the deep breathing that we practiced are more techniques of pranayama or breathing techniques.
Mhm.
Mindfulness-based meditation is similar. They focus on the breath as well. It's kind of based off of Zen Buddhism, and they, instead of spending a certain amount of time doing these techniques, they also really work on integrating it into your daily life. And so, for instance, like a mindfulness technique is like when you're washing your hands, you're really being present. You're focusing on the smell of the soap, the feel of the water. There really means to stay present. And I think that some of these deep breathing techniques and silent meditation can aid to that. Um, aid to being more aware. Mindfulness, it's a little bit of a misnomer because you're actually kind of trying to go beyond your mind. Mindfulness actually means awareness.
Yeah.
And so you're trying to be aware of kind of your real self beyond your emotions and beyond your mind. And that's kind of the basis of mindfulness meditation or any meditative technique.
Got it. We do have some questions in the chat, so I'll start with Melissa. She says, do you have an online or YouTube yoga or relaxation channel that you would recommend?
Yeah, so there's actually a lot of these nowadays. Mindspace is a good one. I also often will look at the YouTube videos of Deepak Chopra.
Mm-hmm.
And the YouTube videos of mindfulness from Thich Nhat Hanh. He's a Vietnamese Buddhist monk who has a following all over the world, really. So I think those are really good ones to start out with. Yeah.
Michelle says, how do you spell the name of the second deep breathing technique?
Okay, it's Ojai, Ujjayi, Ojai breathing. And you can always look, for a refresher, you could always look it up too. There's some videos on YouTube going over the technique. That technique can either be done with a deep breath in and then out through the nose, where you're fogging a glass through the nose. Like, today I taught you guys the one through the mouth. There's kind of two ways to do that.
Charlene, in answer to your question, yes. After, I want to say within about 2 weeks or so, Dr. Mayadev's Zoom conference from today will be available on our YouTube channel, so you can watch it again at your leisure at any time. Our YouTube channel is called the Multiple Sclerosis Foundation. So yes, it will be there. Veronica says, it's sometimes hard to control incoming thoughts. How long does it take to control this? Meditation is harder than we think.
Yes, it is. That's a very good question, a very common issue that we all have. Things take time. You know, we as human beings have been so kind of focused on thinking, and a lot of our being is tied to thinking as a society and as a culture. So the reason why we do the deep breathing techniques before we try to do guided or silent meditation is that we're actually using our physiology to help calm our minds. So there's a couple ways to deal with this. Number one is doing calming things before you try to meditate. So deep breathing, some people listen to relaxation music, maybe taking a walk out in nature. So doing anything that's going to promote a sense of peacefulness, calm, or harmony before you try to do a sitting meditation practice is very helpful. Some people do chanting, anything you can do to kind of reduce the thoughts before you go into meditation. Meditation thoughts come. There's a couple ways to deal with this when you're sitting. One, that some of the Zen Buddhist practice is that they label it as thinking. There's a Zen Buddhist monk named Pema Chödrön, and she has written extensively about if you have thoughts that come during your silent meditation practice, that you actually label it as thinking, and then you go back to your focus of meditation. In our case today, it was the breathing. That's one technique where you label it as thinking, and then you kind of try to go back to what your focus is. The second one is to do what we tried to do today, which is you kind of try to be a witness to your thoughts. So if thoughts come and go, you almost allow them to be clouds and you try to focus on the sky, knowing that our thoughts come and go and they won't affect you as a whole. That takes away from focusing on them, because what you don't want to do is be taken away by your thoughts or fight your thoughts. So it's like you can acknowledge them, but then continue to focus on what your practice is focusing on, whether that's breathing, whether that's a visual, whether that's like a mantra or a saying. All of these techniques help kind of focus your mind. So if you can go from having 16 thoughts at once to having 4, that's a huge gain. And sometimes this takes a lot of time. I mean, meditation and some of these techniques are practice. Just like anything in life, the more you practice, the deeper you get into things and the less thoughts that you'll have. But, there's a saying that you just start where you are. And that's a great place to start.
Heather wants to know if there's a particular posture or way she can hold herself to make it easier. She struggles with diaphragmatic breathing when she's sitting in her chair or upright. So she says she has to lean forward, but she wants to know if there's another approach to it.
Yes. So what we focus on is the spine being straight. And so the spine can be straight lying down as well. I mean, you can start off doing your exercises in your meditation lying down. In yoga, a lot of times yoga studios end with shavasana, which the translation from Sanskrit is just corpse pose. And so you can lie down and do your techniques. Standing up is difficult, but if you're able to stand, that's another way to do it. You can always have a pillow behind your back. I mean, really, it's anything that promotes your spine being straight. And that can be lying down with your legs up, supported.
That's actually, never even thought of that. That's a good suggestion. Michelle says that she suffers from asthma and it's harder to hold her breath for 3 counts. So if you have any recommendations for her.
Yes. So it can be really anything that you're able to do. So you could do a count of 2 and then hold for 2 and then release for 3. It's more that you want your release more than your in-breath or your hold. And hopefully over time, actually, you'll see that you're able to hold your breath longer. I have a background in rehabilitation medicine. And so, before I did my MS fellowship, I did some general physical medicine rehab. And for pulmonary rehab, people who had a lung transplant or people who had severe COPD, we would actually do breathing techniques, especially this one where you hold your arms out and then back down, because that promotes some strengthening of the accessory muscles of breathing. So, honestly, it's just start where you're able to, and you'll see that the more you practice, actually, the better you'll be able to take your in-breath and your hold.
Barbara, I saw that you shared a YouTube link. Do you want to tell us what it is?
I just wanted to get up that Pema Chodron has lots of YouTube videos, and if you know the correct spelling of her name, you'll find it easily on YouTube. John Kabat-Zinn is also spelled a little differently, so to look that up, you might want the correct spelling of that. I didn't get a chance to type that in yet. And those are two excellent teachers that have lots of videos out. And another one is Tara Brach. Mm-hmm. She also has lots of great things that include breathing techniques.
Our next Zoom conference is tomorrow at 3 p.m. with Dr. Adam Chaffetz, who will discuss understanding how to advocate for yourself, your family member, or significant other with MS. And please be sure to follow the Multiple Sclerosis Foundation on Facebook, Twitter, Instagram, and subscribe to our YouTube channel as well, as all future Zoom meetings and teleconferences will be available there again to watch. I want to thank everyone for their participation and attention, and especially to you, Dr. Mayadev. Thank you so much for taking the time to cover this important topic with us. We thank you so much.
Oh, thanks to everyone. And I appreciate you all coming and taking the time to be here with us. So my best wishes to all of you.